What are the latest COVID trends we're seeing locally, and why are they just a bit concerning when you look at the latest numbers?
Yeah, a couple of things we're noting, Chris. One, there are more positivity cases in trauma service area E. We're getting a few more emergency room visits. That's beginning to translate to more hospitalizations. But I want to be careful. This is not a surge. I'm not pushing the panic button, but we are running probably the highest COVID census we've run in the last 60 days. So it's a trend that's troubling, but it's not one that I would say would anywhere be like the surges in the past.
Do your experts know what's behind it? Is it the different variants? Why have cases started to go back up along with hospitalizations?
They have theories. When I talk to the infectious disease doctors, one of the main things I think is only 20 to 21% of our people have gotten boosters. And as a result, they think the vaccines could be waning a little bit and people are a little more susceptible to contracting it. Even if they're not hospitalized, they could test positive. And if you look overall, Chris, 60% of the people in Texas are fully vaccinated. About 70% have had at least one shot, but we're really running behind on those boosters.
So, according to the official numbers, right now the U.S. is seeing about 94,000 new COVID cases per day. But there is a study out today out of New York that says there may be a severe undercount, possibly as much as 30 times in that part of the nation. Why is that so important?
I think it's important because you really, when you go all the way back to the beginning of this contact tracing, you want to know where people have been, where they're exposed. With all the home testing we're doing now, which is good, don't get me wrong, I think it's great. You can test at home. But if you test positive and you're not sick enough to be hospitalized, that's why you're getting undercounting. But if you don't have the undercounting included in the total, you're not going to be able to project and know where you're going to be as we move to the fall and the winter.
Is there a good possibility that a lot of us have had COVID and never even knew it, had no idea?
I read an article. Now, I'm glad you brought that up. I read an article the other day by a physician out of New York, and his theory, based on some samples he had done, many children who were very resistant tested positive, had it, and didn't even know it. And I guess they didn't really test positive, but they caught the virus, didn't know it. He felt like a large number of children have already had it and many adults.
And we continue to hear about this monkeypox. Is this a concern right now in North Texas?
Really a concern in North Texas. I think when I talk to the infectious disease doctors, there's really two things you got to bear in mind. Monkeypox is not as contagious as the coronavirus. It's a different type. They explained to me it is nothing related to chicken pox, but it's in the smallpox family, and you should take it seriously. But generally speaking, physical contact, embracing, hugging, etc., if you have the lesion, is how it is spread. It's not like if you sneeze or cough.